everyone, and welcome to today's edition of Your Health This Minute. I'm your host, Taylor Allen, and let's see what's going on with some breaking news. Cardiovascular disease is still the second leading cause of death in all of Canada. And some research has shown that simply going for a brisk walk 3 to 4 times a week can lessen the adverse effects of the modifiable risk factors of cardiovascular disease. Now, before we get into the rehabilitation process for those with cardiovascular disease, let's make sure we understand exactly what cardiovascular disease is, specifically myocardial infarction, or MI for short. For that, let's head on down. Myocardial infarction, or MI for short. Myo meaning muscle, cardial meaning heart, infarction meaning tissue death from lack of blood flow, ultimately resulting in a heart attack. Now, the heart's main job is to supply the body with blood. But the heart itself also needs blood and therefore uses the coronary system to supply this blood. So what's happening? Heart attacks happen when the small arteries in the coronary system become blocked and therefore stop supplying blood to the heart tissue. A blockage is formed once the inside wall of a cardiac artery becomes irritated and becomes a site for atherosclerosis. Over time, this causes tissue death of the cardiac muscle. Now let's take a closer look at a coronary artery. In a normal, healthy artery, there is no blockage, which allows ample blood and therefore oxygen supply to the cardiac muscle. Once affected by atherosclerosis, it can cause restriction of blood flow to an area of the heart and can also cause chest pain. After a buildup of plaque due to modifiable risk factors, thrombosis can occur, which is an eruption of the plaque. This eruption can cause ischemia proximally, which is a partially occluded blood supply, and infarction distally, which is a complete occlusion of blood supply. Infarction happens when there is a complete occlusion of the blood vessel and allows no oxygen to the cardiac muscles and therefore results in tissue death. Once you have a blocked blood vessel, damage extends proximally over time, affecting the distal myocardium first. After 1 minute, ischemia occurs, which is reversible, and after 20 to 40 minutes, necrosis, which is death of heart tissue, occurs, and that is irreversible. As mentioned earlier, there is a list of modifiable risk factors. Let's go over some now. One risk factor is smoking, Another, obesity, sedentary lifestyle, poor diet has also been associated with cardiovascular disease, diabetes, and hypertension. Now, you may be wondering, how can exercise help? Let's go over a few examples of how exercise can help reduce the risk of cardiovascular disease. For smoking, cigarette smokers are more likely to quit smoking if they are physically active. For obesity, regular aerobic physical activity is associated with weight loss and reducing the risks of cardiovascular disease. Regular exercise can greatly reduce risks of metabolic syndrome, which include cardiovascular disease, diabetes, and hypertension. You can't outtrain a bad diet, but regular exercise has been known to increase an individual's interest in healthier food options. Regular exercise can greatly affect resting blood sugar levels and also reduce complications regarding diabetes. Lastly, for hypertension, regular aerobic exercise can lower and regulate blood pressure and reduce the risk of cardiovascular disease. All right, welcome back. Thank you, Phil, for your incredible drawings. Now that we have a better understanding of what a myocardial infarction, or MI, is, let's go over some specific prescriptions for aerobic, resistance, and flexibility training. To make this simple, we can break it down into the acronym FIT. F-I-T, and sometimes T. For this, let's start with aerobic. For the F, you want to do aerobic exercises at least 3 days a week. And for the intensity, which is I, you want to have a rate of perceived exertion of 13 or less to begin, but that can increase to about a 16. Heart rate can be about 60 to 70% max. And for type, you can do brisk walking as suggested earlier, or cycling as well is a really good option. And you want to do this time-wise for about 10 to 15 minutes at a time with ample amount of rest in between. And you can do that for up to 30 to 40 minutes. Now let's go into the F for resistance training. So for frequency, you're going to want to do this again 3 days per week. And this can be later combined with cardiovascular conditioning. For intensity, you're going to start with 1 to 10 reps at 50 to 70% 1 rep max. And for your type, you're going to be using different machines or body weight exercises. Lastly, for your flexibility training, which is also very important, for your frequency, you're going to want to do it at least 3 days a week, up to 7 days a week. And for your intensity, you want it to be below or at the point of just discomfort. For your type, an example would be a sit and reach or a static stretch or dynamic before an exercise. And for time, you want to hold stretches for 20 to 30 seconds, up to a minute per side. All right, well that's it for me today here at Your Health This Minute. We'll see you next week for the latest edition. Have a good day.